So the next hour is to teach you all of the bee diseases you need to know. But in reality, we're going to remember beesneedvets.com, MSU website, and or your Washington State extension, and just know who to talk to, right? We're not specialists with every species, but we do know who to tag and phone a friend for our colleagues. And you guys can always email me and or call me, and we can chat about hive diseases. But I'm most likely, if I don't know what it is, I'm going to tell you to go to Megan. So I always share this picture. This is how it all started. And I was one of those beekeepers with my sister that had, like the perfectly like purple boxes with stencils on them. And so my sister was smart, I guess, and got out of beekeeping. She'll still help me if I like rope her into it. But we started this as a hobby together. My dad passed away in 2016. And so this was kind of our thing to keep us going and just kind of have something to do. And so it is special for that reason, but it has really kicked on my science nerd hat as a veterinarian, and I kept up with it because I really enjoy it. I really enjoy the science behind it. And I love working with beekeepers and teaching, and this was a perfect avenue for that. So why should the beekeeper need the veterinarian? The biggest reason, again, they reach out to us is the veterinary feed directives, or they think they need a veterinary feed directive. The reason I would like them to reach out to us is to become better beekeepers, and for us to be kind of one of those sources of information for knowledge as far as preventative medicine and trying to prevent some of these diseases from even happening. Most of the time I'm going out to hives to diagnose a disease in the colony and looking at abnormal versus normal. A lot of beekeepers, if they're like a 2-3 year beekeeper, they kind of know that something's going on, and they'll pick up on that. Like I said, the most common diseases I see are those two. I like to be on the newest research kind of standards of care, and I certainly am lucky in that I have connections with my team at Michigan State, and I actually just spoke last weekend at the Southeast Michigan Beekeepers Association, which is one of our regional events, and it's a big event for the state of Michigan. And of course, during that time, tagged all of my big people, told Anna, Dr. Terry Kane, who wrote that veterinary medicine book, and I was like, you guys, what are the new things, to make sure that I had everything to tell you guys as well. And ultimately, it's been a lot of mentorship that has developed into friendships. A lot of these beekeepers I still work with, networking, and a lot of them are in my community too, because of where I'm traveling to see these clients. I always talk to people about, there are hive problems, and I'm not someone that's gonna be like, oh, I have to come out to see your hive. If I think it's something I don't need to see, I'll work through it and give them other solutions. So just having a state extension service is really helpful. A lot of our states do have them. Local bee clubs becoming one of them, because having a mentor, many times you can talk it through with your mentor and or have your mentor help, and they don't necessarily need a beekeeper or a veterinarian for these things. And that's just another one of the beautiful stencil hives. If we do need a veterinary feed directive, this is what it will look like. You can actually get these on the AVMA website. A lot of the like Dodon, Man Lake, a lot of the websites for Honeybee or for beekeepers will have links to them, so you can find it there. But I kind of just, here's all my personal information for you guys. But you can see this is how you would fill this out. The client would fill out their area. And then the most common drug we're using is oxytetracycline, and that is for European foul brood. And so you just kind of learn the terminology of what they need on these. And what information we need. And you do have to sign these. You do have to talk about the withdrawals. So there is, just like in our other livestock species, there's a withdrawal time. And so for this, it's 6 weeks. So you just have to kind of pay attention to those things. Oftentimes you have to learn this once and then just kind of store it somewhere so that you have it. And then and if you don't know, you just reach out, and once you have it filled out, it's usually just the client has to fill out the rest of it. But they do have to have a veterinary client-patient relationship to get this. And so that is where they're reaching out to us. I'm sorry, that's cut off a little bit at the top, but the treatment plan for the colony or the apiary, I like to put this slide in here just to remind us. I think as veterinarians, we do look at diseases this way as like a hive health approach, or in most cases, we think of it as a herd health approach. And so whether they have 2 colonies or 200 colonies, I think Megan always is reminding me, if I have a colony that looks like it's kind of on the out and out, like we need to talk to the beekeeper about saving that hive, which essentially is like if you have 10 sheep and you have one that's really sick and or has a communicable disease that's potentially, infectious to the rest of the herd, are you usually going to try to save that struggling ewe or whatever, or you're going to try to save, in this case, maybe it's 200 in the herd? Well, most of the time we're taking a herd health approach. And so you have to think about the colonies like that as well, in that sometimes we do have to talk to these beekeepers about potentially sacrificing that colony if it's not doing well and or has European foul brood, because the other 10 colonies they have or the other 100 colonies they have are perfectly healthy. What I'm deciding to treat with does depend on time of year, mite count, what disease pressure, is it mild, moderate, severe, the size of the colony, is it a pretty healthy, robust colony, or is it a colony that looks like they're on the out and out and we maybe need to euthanize them? There is actually, in case I forget to tell you guys, in the next probably 1 or 2 months, there's an entire publication on honeybee euthanasia that is coming out. It'll be coming out, I believe, through the AVMA. And so now we have a resource as veterinarians on how to appropriately dispose of a hive if we need to. Recheck follow-up, is an antibiotic really even required? Most of the time it's not. Here's the resource for you again. If you just memorize this slide, you can zone out for the rest of the talk. This is really important, and I think this is really cool because probably about 6 years ago, I was at a barbecue, like sitting in the backyard talking to Megan and Anna, and we were like, man, it would be really cool if for beekeepers or for veterinarians, we had like this honeybee certification program that was standardized, and like everybody had this resource, and then we could all be bee experts. And it's now actually come full circle, and we have it. There's a lot of people that were behind this, but if you go to this website, there's this circle here that says the Honeybee Veterinary Consortium, and I would encourage you all to become part of this. This is the kind of organization for honeybee veterinary medicine. It's kind of like the AASRP of small ruminants. So I would recommend joining this, getting on the newsletter so you are on the up and up. But this, if you click on it right now, just has a sad line that says to come. So it's not up and running yet, but it will be. Again, it's one of those things that'll be out in another 2 or 3 months. The course is going to be 150 continuing education hours. I believe some of those will be in-person options. A lot of it will be online, but you will get this fancy certification. So it's kind of the closest we're going to get right now to like a board certification. This is like step 1. I don't know if we'll ever get to honeybee board certification. I wouldn't be able to survive another board exam. But the certification sounds pretty cool. And I think that across the states we'll be having like state local things as well that I'm sure will verify and count towards the certification. And if you're really nerdy like me and you want more continuing education to do with honeybees, this year it's very cool. So I wanted to highlight for you guys, every other year or every 3rd year, the conference is virtual. So the Honeybee Veterinary Consortium has a virtual conference this year, September 21st and 22nd. And so I think that, with COVID, I think one of the things that was positive that came out of that is we found how good we were at doing virtual things and being able to have this more widespread knowledge to everyone. And then if you're a nerd and you want to go to a bat cruise or a bee excursion, the AVMA convention in June is actually going to have both. So they're doing a whole pollinator program and kind of highlighting pollinators as a whole and just kind of opening our eyes in veterinary medicine to the other pollinators. And so they put together these really cool excursions. So if you're into that. I put these up front. Now, these are not diseases, but I find that like veterinarians, we are the go-to people, especially if you don't have somebody that does honeybee medicine in your area, to know about these things that are newer things potentially. So there's 2 slides. I just want to spend a few minutes on each to talk to you guys so that you can sound smart when people ask you, hey, I heard about this honeybee vaccine, like what is it? So it's an American foul brood vaccine. It just came out last year. So there was a lot of things that had to happen for it to be in our hands, but now it's actually something that we can truly order. It's the world's first honeybee vaccine. It is basically like a food vaccine. So it's mixed in the queen feed, it's fed and consumed by the worker bees. The queen ingests it, and then fragments of that go into her ovaries. And so basically, if you get a vaccinated queen, then you can have essentially a vaccinated hive. Because it's like, I like to equate things that I know. If you're vaccinating the dam before she kids, the month before she kids, then you've got that immunity being passed on to the kids, right? So the queen is passing these genetics on to the other bees. And beekeepers can actually purchase this vaccine, or they can purchase vaccinated queens. You do have to have a certain number of hives to purchase the vaccine right now. So I think that's really the only stipulation. And I could not find the actual cost of the vaccine. I still need to figure that out. But the queens weren't that bad. They were like $10, $15 more. Most queens are about $45. So then they become like maybe $55, $60 for a vaccinated queen, which I didn't think really was that unreasonable because you only need one queen for your hive. So that's something to consider. I think that's very exciting because I see an American foul brood vaccine. I see the next thing coming is European foul brood vaccine. And if any of you have read any of the literature, European foul brood is really big, especially when we're talking about blueberry pollination. And Michigan State and Washington State actually has done some research on that as well. And so if we could have a vaccine for that, that would be great. The other hot topic is newer mite treatments. And as a veterinarian, you do need to kind of know these because people are going to try to, just like in sheep and goats, give their animals, or in this case, honeybees, like everything that's new, right? They're going to try to get their hands on it. And you're like, what is this product that you just gave them? So this is a newer product that's out, but this actually is a registered Amatraz product. In the past, if you know nothing about Amatraz, it had to be in the hive for 6 to 8 weeks, which was a very, very long time. It could not be used when honey was on the hive. So we call honey supers, like the boxes that are containing the honey. So it couldn't be used with honey on the hive. Now the flash treatment is a 7-day treatment with a 0 honey withdrawal. And we like that word, right? Whenever we're dealing with livestock. So this is something you might see your beekeeper clients using. And it is a legit product, not just one that has fancy marketing stuff, but they do have very nice marketing pamphlets and instructions on how to go through and use it. The one thing about Amatraz though, the 6 to 8 week treatment, they saw a lot of resistance to it. It wasn't treating varroa mites as well as we had hoped. So potentially, I don't think a lot of research has been done yet for us to fully say this, but maybe the flash treatment, if it's hitting them hard and fast, maybe it's gonna do a better job at mite reduction. This is a very boring slide, but it is to tell you that there is this really nice and very thorough advisory on the application of all these substances to control varroa mites in beehives. Because what is happening and what has been happening is beekeepers are getting their hands on these products that are not registered or approved. And so you probably should know about this regulatory organization. This was just published in January, so just 2 months ago, but it is pretty comprehensive. And if it is not on this article, it should not be put in a hive. This is not one of those things where you're like, oh, I have a veterinary client-patient relationship, so I can just tell you, yeah, go ahead and use that. It should not be in the hive. And so you may be the one that has to have that discussion with the beekeeper potentially. These are some of the top diseases we're going to see in the hive. So we'll go through a couple of these. And I tried to do a case-by-case approach because that's kind of how my brain works. And I love pictures. That's how my brain works. So hopefully this will help you guys to kind of think things through. But back to the basics, this is the brood pattern. So we know what a really pretty brood pattern looks like. And then we flip the slide to an obviously spotty brood pattern. So this one's a little more obvious for you, but this is a deep frame. So you can't tell that because there's no perspective to it, but it's a very wide frame. And there's a lot of brood missing from that frame. And then same thing, I use this classic frame. So this one, you know, the other thing you might notice here, it's kind of hard to put in perspective, but depending on what time of year this was, this hive is not only struggling with a spotty brood, they're struggling with food sources. Like this is not going to keep this hive alive. They've got this for food on this frame. Now, if all the frames look like this, then this hive is in trouble, right? So you have to put in perspective, does the entire hive look like this? Or is this just one frame that I pulled out and made the hive look bad? So you have to go through, especially when you're doing disease evaluation, you have to look at more than just one frame. So case one was a beekeeper that contacted me regarding spotty brood. He knew what he was seeing that was abnormal, but he didn't know what it was. He had 15 years of experience. He had around 10 colonies between 2 apiaries. So now we have a potential for disease transmission between the 2 apiaries. He treats for varroa mite, but he only does oxalic acid. I'm not going to teach you guys all you need to know about those. You really don't need to know every single treatment for mites. You just need to know the varroa mite decision tool from the last talk. But he does oxalic acid, and he usually just does that in the fall. So maybe this is a varroa mite problem if he's only treating once a year and he's just kind of throwing the treatment at them like a calendar treatment rather than if it's really a problem. And he's never had an issue before. So some of the things that I noticed on this hive, there's actually a lot going on here, but just to kind of point out to you guys, I made this problem, so that was me. But down here, you can start to see the larva, like the edges of the larva This is a dead larva. This is a larva that is kind of curled and twisted. And then up here, these larvae, what I notice here is they're starting to get dry. And I'm going to show you normal on the next slide. But there's really no brood food in here for these larvae. And then this one's all twisted up to the side. This one's twisted, and you're starting to see what we call tracheal rings on that one. So we'll go back to that. I have a lot more pictures, but that's kind of what I see there. There's a lot going on in that hive where I see there's some disease. I tried to get the best picture for you to kind of highlight, like, this is what it looks like when it's normal in that upper left corner. You can see just like this milky substance. That is happy larvae swimming in nutrition. That is how they eat. And it's actually pretty cool if you look at them on a microscope when you're doing, potentially doing like queen rearing, and you have to move the larva, you can actually see them like eating this. But as you get down here too, like you can still see these guys are all swimming. They're swimming in their food. So this is happy, healthy brood. As they get bigger, it's a little harder to know, but what I want to highlight on this one is this last one, they're all white. This isn't just the sun on that left corner, they're all white and happy. And this is not a photo thing or altered, they're all yellow and not happy. And so we're starting to see maybe there's some disease going on here, maybe there's something happening here. And one of the things I notice here is if you pull these larvae out, and which you would definitely do just to kind of evaluate them a little further, they're dry, they don't have any nutrition, and then this one's twisted. And so when I start to see this, I tell my vet students that they all have stomach aches, and that'll make more sense when we talk about the disease, but that's definitely something that just helps me remember the disease. And then again, tracheal rings are coming here, they're a little more prominent, so you can start to see the striations. And then even more so here, you can see the tracheal rings. You can see those, like, basically, you know, it looks like if you were looking at an earthworm, you don't normally see those little rings, and you can start to see them very, very prominently in these. And then when you start to get to the hive is rotting stage, it's really hard to tell what they are. This is kind of caked, but you'll see some of the more pictures with rot. So this is, I should have asked you guys, I should have quizzed you, it's still early though. This is European foul brood. So this is one of the most common diseases I see in the hive, the larva, and this is directly from the beesneedvets.com website, so you guys can see these resources more than once. They're malpositioned, they're twisted, and so I kind of think of when you get the stomach flu, what do? Like you curl over and you kind of go into the fetal position because your stomach hurts and you don't feel good. And so this is a bacterial disease that they get, but I also think of it as like the larvae have stomach flu. They're usually discolored. They go from yellow to dark brown as the hive kind of starts to rot. They have a visible trachea. Sometimes you can see dried scale, although I tend to not remember that because then you can start to confuse it with other diseases. And the caps can also be sunken, mainly because they're starting to die off. This disease was not named after me, but it helps me remember it because it's a bacterial disease, Melissococcus. And then I always put M. friends because when you look at the research, it's not just that bacteria. Usually there's other bacterial diseases that are happening as well. The organism gets mixed in the brood food and then it's fed to the larva. And so the nurse bees are just spreading it like wildfire all over the hive. So it's important because it's not like you can go out, you don't have to treat it that day, but you should treat it that week. This is a disease that if the beekeeper is going to treat it, you don't wait several weeks to see them. The earlier you can get treatment into that hive, the better. And most of the time, this isn't something that like I just have stored on my shelf. I mean, now everything acts like Amazon and you can get it next day, so they can all compete with Amazon. So most of the time, the companies, you can order that day and usually have it by the next day or two. And that's what I usually encourage the beekeepers to do if they're going to treat. You don't want to wait another week or two and then put treatment on the hive. The disease is going to progress pretty quickly through the hive. It is associated with colony stress. So when the bees are stressed, and that is one of the associations they have found with the blueberry pollination, and it tends to subside midsummer. So this is one of those diseases that, depending on the hive, they could almost like the stomach flu, right? You don't die from it usually. I mean, you might have to get some level of emergency or urgent care help, but most of the time you're going to survive through that with supportive care. And in this case, the same thing, but it will reappear in some hives in the fall. So when I see it is early springtime when everybody's getting into their hives, usually like the first month, and then it resurges again in some hives in the fall. This is directly from the Bees Need Vets website. And so these are some other pictures you can see. This is just a very close up of the yellow disgusting larva. And then you can kind of see the tracheal rings here. I like this photo too, very obvious, some of the symptoms you're seeing. And then it starts to become this like rotting larva. These are ones you don't want to test when you're doing the disease testing. You want to test the ones that are kind of just starting to look sick. And then some of these are on the other side here, kind of twisted, and this is a late stage larva that has like melted down to nothing. So you don't really want to test that side. The important thing to know about this disease is it's pretty easily transmitted. Again, every colony has varying degrees of resistance, but when you have robbing and drift, so robbing is where bees from other hives will come into the hive. If they get past the front gate, so to speak, they'll steal food. And so thus they're going to steal some disease as well, right? And then they're going to fly back to their hive and give it to the other hive. And so that's the importance of having the hives away about 10 feet so that you're reducing the chances of drifting. And drifting is usually robbing or confused bees that are happening in your own hives. So they're actually getting confused. If the hives are right next to each other, they're drunk and they come home, they go into the other hive. And so that's drift. And so drift is going to happen if your hives are too close together and or maybe you don't have something to signify the hives are different, like putting shapes on them or colors. So just important because European foul brood, if it's in one hive, not always, but you do have to talk to the beekeeper about it going through all of the hives. Contaminated honey is a big one as well. So refeeding honey from a hive that maybe died and you don't know why it died, you may want to keep that in mind. But the most common place where we get the transmission is the comb. So I just put this in here, looking at some of the research that has been done from the least contaminated equipment or source. So the queen's pretty negligible. And then all the way down to the comb, you're gonna have an extremely high risk. So one of the reasons why we encourage beekeepers to not get bee equipment from old beekeepers, because that's how you get American foul brood in your hive, and that's how you get European foul brood, because it just sits in the hive. And so try to start with brand new equipment, even though it's probably about 500 to 1,000 to start your first 2 hives. I put this together as the 5 R's of treatment because the last one is antibiotics, and I don't always feel like we need antibiotics to treat this. So there are some other ways that the beekeepers can treat. So you're going to remove the affected brood frames and replace it with healthy brood. And this is where it becomes important to have 2 or 3 hives, because now we're beg, borrowing, stealing from the healthy hive, which hopefully the other one is healthy. And you're going to take a couple of brood frames if they can spare it, and you're going to give those healthy brood frames to the diseased hive. Again, this is the whole thing, is if you have 200 sheep on the property, are we going to beg, borrow, and steal to save this one hive? Does it look like it's worth saving? Is it early in disease? Or do we need to just think about euthanizing that hive, that colony? Reduce the stress on the hive. So this is a situation where you would feed them. Most of the time it's going to be sugar solution, so the carbohydrates, not really the pollen, but sometimes we do need a pollen patty in there if they don't have any in the hive. And then refuse the queen. This is a talk about where is the disease? It's in the brood. It's in the larva. So how do we break the cycle? We remove the queen, whether that's temporarily or permanently for a brood break. So you can't do it forever because then you're going to create other problems down your hive. But you can remove the queen for a week or 2, and then you break the brood cycle. So all those sick bees and those sick nurse bees that are feeding those sick bees, they're going to need a different job because there's no queen now. So there's no brood to raise. So you're going to basically kind of establish where those bees are going, and that helps improve the hygiene of the hive. Reusing the bees. So this is a little bit more cumbersome, but this is a shook swarm method where you're literally taking all of the bees off of the equipment, which, remember, on the transmission risk, the equipment is the most diseased. That's where the highest risk is. So ideally, if you had new foundation, and people call this golden comb, because if it's already drawn out, and it already has the cells, so the wax foundation is already on it. It just needs either eggs or honey or pollen to be put in them. If you have brand new foundation, that's perfect. So essentially what you just did is you gave your diseased hive a brand new home, your diseased colony a brand new home. And not an infected home anymore. And so you're helping to reduce the disease there because you're bringing down the disease pressure. And last but not least is rot. So I reach out to a vet, and this is oftentimes when they're reaching out to us, when the hive is already rotting. And at that point, I do have the discussion of, is it really worth it to do antibiotics? Because antibiotics do help and they do work, but do we put our resources somewhere else for that hive? Yes.
How do you remove the queen without like killing her and without making the hive start requeening?
So very carefully, you have to get used to picking up the queen. She will sting as well, but if you pick her up, usually by the abdomen, you can move her that way. When I first started off, I would just encourage her to go into a queen box, which is easier said than done because I was so afraid to touch them and hurt her. So you can, if she doesn't really know and you act quickly, you can encourage her to go into a queen box and then trap her in that. And that effectively will do the job. You could just leave her in the queen box and then the worker bees will still feed her and keep her alive. You can't take her in your pocket and into your house. That doesn't work. And you don't leave them on the car when it's a hot day either, because that will kill your really expensive queens. So if you talk to Megan and all of them, we've done all these, left it on the ground, rolled over it with your car. But you want to effectively remove the queen or just take her out of commission. So if she can't walk around, she can't lay eggs, then you've broken the cycle. Some people will truly just kill the queen though, pinch her off and kill her. Things to know. Most of the time you do not need to report European foul brood to the state. That's American foul brood and that's state by state still too. But some of the older beekeepers are going to be afraid to reach out to you potentially because they think you're going to come burn the hives, and you don't need to do that. And you don't always need antibiotics. So I have the discussion, but oftentimes by the time I'm out there, I usually am using antibiotics. But I do have some beekeepers that once they hear the options and we discuss it, sometimes they want to try that and they don't want to do antibiotics. If you're doing antibiotics, you need to fill out this fancy form. Okay.
Question.
Yes.
So if you, the hive is the fomite that harbors the bacteria, can you remove the frames and wash it with soap and water or disinfectant based or?
Unfortunately not. So they've looked at a lot of things with trying to sterilize the hives. They've looked at heat, UV light, freezing them. So you can all of those in variation can kill the bacteria, but not 100%. So oftentimes the best solution is brand new equipment if you're trying to use that as the treatment option. And it gets very cumbersome because the bees have done this perfect job of making this drawn out comb, and the majority of it is wax. And so it's really hard to clean. So most of the time you could melt it all down and reuse it that way, or make candles out of it. But in theory for this, you want to use drawn out comb that is healthy from or that is disease free from a healthy hive. The other thing I didn't mention to you guys is most of the time that disease is a clinical diagnosis. So you guys saw a lot of pictures. Most of the time that's pretty classic what you're going to see. And so when you get used to seeing European foul brood, a lot of times I just have people send me pictures. If I have a relationship already, I've been out to that apiary and I know that beekeeper, I just need a picture or a video in that case. And we can talk about options. My newer beekeepers, though, I'm usually always going out, but I can diagnose it based off of the frame. Right now, it's very hard to find the snap test or the like hive side test. They look just like pregnancy test, and you will take a little bit of the early disease larva, not the ones that are all rotted. The early disease larva, and you would take the little swab, just like you're doing a COVID test, and you would swab the larva. And then there's a little solution that you mix with it and you put it on the test kit. They have test kit for European foul brood and for American foul brood. But for some reason right now, like most stuff in veterinary medicine, they're on back order. And even like Megan and Anna and my Michigan State people are not sure when they're coming back. So you should know about that. Some beekeepers might have one and they may have already done it before they call you. But most of the time this is a visual inspection. The only time I usually use those lateral flow tests is just sometimes for funsies because I'll have expired ones on my truck because I don't normally use them. I'll have students with me and or I'll want to teach the beekeeper how to do it. But that's how you would diagnose it.
Question.
Yes.
How do you choose your treatment option versus treating with antibiotics, just changing all your equipment over to hive euthanasia?
Yeah, so it's really dependent on the beekeeper and how big their operation is and what time of year it is. So if it's a relatively healthy hive with very little disease and they're catching it early, then usually I'll try to do some of the other, like the 5 R's rather than treating. If they're in like a medium, like middle stage disease and or they're a hobbyist like beekeeper where they're calling me out specifically for antibiotics, in that case, I probably will treat them. Most of the time too, because like the shook swarm method or requeening or touching the queen or moving the queen, like those are all things that are not stuff I have time to do for them. So like my goal as a veterinarian is to discuss these treatment options with you, right? But I'm not going home with the dog owner to administer medications every day for a week. So like they have to decide which one is going to fit their lifestyle. And so that's usually where the discussion kind of leads me to antibiotics versus non-antibiotics. And like how many of the hives are affected. Is the whole apiary, like are all of the colonies affected? Then I usually am going to treat for that as well. If it's a single hive, and like I said, if it's relatively healthy and caught early, then I may encourage them to try just some of the supportive care methods. Yeah, but it's a good question. And ultimately the answer is, it depends, which I know is hard,
Sure.
and that's where a lot of times I will use my resources. And oftentimes when I first started up, I would call Megan on a lot of these cases and I would send her pictures through our iPhones, right? That's the nice thing about having technology. And I would say, hey, what do you think? And she would like, be like, okay, what's this, what's this, what's this? You know, what does the colony, what do the other colonies look like? What does the apiary look like? And then we would make a decision on whether or not we treated. So now it's more just to like use your phone a friend if you're concerned.
I have another question.
Yeah,
So I would assume it depends upon the experience of the beekeeper, whether they're alerting you, I've got one affected, or I think I've got 3 of my 10 affected.
yes.
I mean, can you give me a feel for how that plays out? You have to go inspect all 10.
Usually. I would say the vast majority of the time, yes, I'm going into all those hives. Unless I have like the initial person, this was a real case, you know, the guy that had been beekeeping for 15 years. I just went into 1 or 2 of his hives and I knew based off of, I knew him, I knew his experience level. He's part of our local bee club. So I also know his level of knowledge and I went into 2 or 3 of the hives to confirm the diagnosis and then, you know, let him decide from there if he wanted to treat everybody because he knew there were only a couple that looked infected at that time. So I didn't really need to waste my time to look at the other ones. I had enough by looking at the first couple colonies. But you do have to make that decision though, because if you go out to a colony with 200, I am not looking at 200 hives. I don't have time for that. So you do have to make a decision too with the beekeeper on which hives am I looking at today? What disease are we concerned about? And then I might decide, you know, based on their recommendation and then based on what I'm seeing at the entrance of the hive. Like, do I know that maybe there's an entrance problem at the hive and I'm not seeing a lot of bees coming and going? So there are some other things as an experienced beekeeper, because I've been beekeeping since 2017, you don't need to be a beekeeper to be a honeybee veterinarian, but there are some things that I pick up on because I am a beekeeper to know, okay, I should go into that hive. But most of the time the beekeeper knows. Have you ever worked with sled dog animals? So, I mean, that's a good example. I always thought, oh my God, but you come in at their checkpoints and they're grabbing a veterinarian because they know their dog's off, they know something's wrong, and they're pulling that dog before you even tell them it needs to be pulled. So that's kind of, honestly, I feel like beekeepers do care about their bees because it's their livelihood if they have a lot. You know, they're depending on it financially. So they'll usually tell you. I like these because they're really good teaching hives. This is not something that needs antibiotics, but you might be called out for this. And so this is a laying worker hive, laying worker colony. And I'll show you some things on how we kind of diagnose this. But I call this is like the honeycomb. Like if you remember, if you're old like me and you have the honeycomb cereal that you used to eat, like if you put the frame on the side, you kind of see that. That's just what it reminds me of. So I have some really great pictures of this, but essentially what that is it's drones. So if you don't have a queen, basically what happens is the workers start to get confused because there's no queen pheromone and the workers are like, we need a queen, so I'm gonna be one. Like, right, that's what happens in society too, right? There's no leader, you become the leader. So there's no queen, they start to figure it out, and the laying workers, and oftentimes it's multiple laying workers, they're like, no, I'm the queen, no, I'm the queen, and they all start laying eggs, interestingly, that they can do that. There's one difference though, the laying workers can only lay drones. They're not inseminated, right? They're not like queens, they haven't flown out and connected with multiple drones and then come back. So you're gonna get this popcorn appearance because they're all drone comb, and drone comb, if you haven't seen it yet, drone comb is the honeycomb bubble. Worker comb is flat to the frame. So I'll try to see if I have a difference between them, but try to see if there should be a couple of. Okay, so this is what I'm looking for at the level of the hive when I go into the hive, and I hope you guys can see this. I always get really excited when I see these in hives because I take pictures. So you can see there's 2 eggs. There's 2 eggs. There's 2 eggs in that one. And so you start to see, not only is there 2 eggs, but if you start to notice, a lot of them, not all of them, are off on the edge. Like this queen doesn't know what they're doing. So they're not laying them in the center. And so here's a nice happy, this is a great example. This is what we call burr comb. So it was like just on the edge. So I broke it off so that I could take a good picture of it. These are happy eggs from a happy, likely from a happy queen. Remember the first 1 to 3 days they're in the egg stage. So this hive was probably queen right that I pulled this off of versus this one. There's a problem. Also, these eggs don't even look normal, some of them. They're all like tiny little rice noodles, and you can see there's like 10 in each of them. So this is a late worker hive. I don't like to treat these. I've tried. I thought when I was first a baby beekeeper, this is one of my hives. This is what they look like now. They're all different colors. They actually look worse than that. I don't have any stencils anymore. Nothing's color coded. Yeah. So, and they get 10 high like this sometimes because I just don't have time to deal with it. So this was actually me having a laying worker hive because I teach and I don't have as much time now to get into my hives. So my solution was to just combine these 2 hives, and then you put a newspaper trick between them or a piece of paper between them. So you have the hive at the bottom that knows what they're doing. And then you have this hive at the top that, I don't want to say that's a waste, but that's all like honey boxes and laying worker hive. But now I just boosted this hive up, and with the newspaper in between, it takes a few days for all the like bees to kind of come and go. And so you're not just like moving 2 families together and being like, live together. You're moving them together and you're like, hey, it would be cool if you guys all just lived together. And so you're slowly combining them. And what happens is the laying workers start to sense the queen pheromone. And then they get the memo that there's a queen. And so they can stop laying eggs. And if they do what they're supposed to, they completely stop laying eggs and you become queen right again, because the bottom of this hive is queen right and is doing everything they're supposed to be doing. And so they have a happy home. And so you try to combine them. That to me, I think has worked the best. And it's also the easiest. The other way is literally like getting a queen right, getting a queen, shaking all the bees in. And then oftentimes you have to like lock the queen down so that they don't kill her. And you have to protect her for usually 5 to 7 days until they get used to the idea that they're not queen anymore. So sometimes it's really hard to convince a hive that that is the case. The other thing that people do is they walk about 200 feet away, and I've done this before too, and I just shake all the bees out. And I say, you've been evicted. You're going to need to find a new home. And what ends up happening is they drift into their new home. So they find whatever colonies, and it might not be colonies that are on your farm. They might find a colony down the road, but eventually they find a new home to move into. And when they get there, there's a queen. And so they stop laying. So that's another easy way too. I would recommend doing that with, like, usually they're not, the other thing is usually they're not angry in the early stages. They're pretty happy because they think they've had a solution. In the late stages, this is an angry hive. So you want a smoker, they're going to be stinging you, they're confused, they've been overworked, and there's like nobody's setting any rules anymore. So they're an angry hive. So I tend to just shake them and leave them, or I'll do a combo like this, which the combination does tend to work as long as your hive on the bottom is healthy. Okay, case number 3. I hope, because I've circled these, that you guys will be thinking about a disease before I even say it. So these ones are highlighting what? What am I circling? Yeah, deformed wing virus. And so that one is most commonly associated with parasitic mite syndrome or parasitic mite brood syndrome. There's 2 different names. People kind of are toggling back and forth. But if you just remember PMS, they remember that parasitic mite syndrome. So also in this hive, you could see that there was bees with mites on them. And so then we had more bees with mites on them. You guys saw these from the last one, really sad looking bees. And so the thing to note is which came first. A lot of times you're going to see parasitic mite syndrome, but if it's really far gone, you might see European foul brood or chalk brood or sac brood or something else going on. Because remember, the parasites bring in the viruses, the bacterial diseases, and sometimes fungal diseases, because now they're diseased and stressed and so immunocompromised, and they're going to get other diseases. But you will see parasitic mite syndrome as a standalone disease in the hive. The biggest ones that are unique to the hive, which I'll highlight at the bottom, is there's mite frass, which is literally mite poop, that is on the ceiling of the cells. So if you kind of flip the frames upside down, you can see it. The adult bees will have deformed wings. The adult bees will be stunted and kind of just look like they weren't made right. Something was wrong while they were developing. And why was that? Because there was 1 to 7 varroa mite larvae that were feeding off of their fat bodies, which is the abdomen, while they were trying to grow. Of course, they're not going to develop right because something was chewing on them while they were trying to develop. And then signs of secondary bacterial diseases. And the colony starts to dwindle too, because what happens if you don't have, every worker bee has a job, right? And if you have a bunch of workers out sick, what happens? The team starts to fail because you don't have others that are helping out. I like this slide mainly because I'm a veterinarian, but a lot of times beekeepers don't like this slide, but it does put in perspective, like this is what we're talking about. The varroa mite here, there's 2 on this one, there's 1 here at the abdomen, like they're all over this sad bee. You're not going to ignore this. Most owners aren't going to ignore that. Most owners are not going to ignore tapeworms when they see them. They're going to call us and freak out, right? And if you like these, most of these are like rescue cases, right? But you're not going to ignore that. You won't even ignore 1 tick, but it brings the point across that like, why are we having honeybees as beekeepers and we're ignoring that they have these big mites on them, which you guys saw in the last picture, it's like a volleyball on your back. Why are we ignoring this? And that's because most of the time they can't see them on the bees, because remember they're on the belly, until there's a huge problem and now they're all over the hive. So we need to educate in this disease, we need to educate how are we going to prevent it in the future? Because oftentimes when they're like that, we're usually not saving them. And we can talk about treatments for those, but it's definitely a consideration of, are you putting a bunch of diseased bees that have mites on their backs into a healthy hive? I wouldn't want to, because all those adult mites are going to go into that hive. And now, even if you have a healthy hive, you've just challenged them, because what are all those adult mites going to do? They're going to go back down into the cells and grow with the new larva and exponentially develop again. So teaching the mite count, I'm not going to go through this again, but some of the pitfalls, which I already mentioned some of them, too much smoke, not having enough sample size. So this is my trick. This is literally what I do. I have these cups and I put the markers on them and I keep those in my truck. I have a little box that is like literally my hive stuff. So, and then I usually will just on my hive days bring my equipment with me, like my my bee suits and stuff with me. Insufficient shaking. So once you get them in the alcohol, you really have to shake that to get all the mites off. And sampling the wrong bees. You want to sample the nurse bees, the younger bees. So you're going to pull out a frame that has a lot of brood on it, a lot of larvae on it. And those are the hives that you're going to sample. And I take the sippy cup and I usually tip the frame upside, like sideways. So it's like this. And I just drag, people do it 1 or 2 ways. The Megan Milbreath way is I just gently roll the bees. And so I knock them with the cup as I roll the cup down and they fall into the cup. And then every now and again, I'll shake the cup to like make them fall into the cup so they don't fly out, because inevitably they're flying while you're doing this. Like bees are all over the place. So this is why you need to get comfortable going into a hive, because if you're not, and if I was a first-time beekeeper, I'd be freaking out that all these bees were going to sting me, but they don't. They don't. You just roll them in and they fall into the cup, and then you're going to sample those younger bees. So what do we do if we have a really diseased hive? We're going to go to this toolkit, and I'm sorry that website isn't coming up there at the bottom, but Honeybee Health Coalition. If you look up varroa mite decision tool, you'll go right to it. It's a very active website. If I'm going to combine these bees, what I'm going to do is I'm going to treat them for varroa mite. In a perfect world, what would we do if we have a really high parasite load in sheep and goats? We're going to treat them, and then what would we really want the client to do or the farmer to do? We would love for them to repeat a fecal. Do we ever get that? Not always. So ideally, you'd repeat a mite count to confirm that the mite count is low, and then you combine them with another hive. Because most of the time, this hive is not going to survive. It's in the middle of the summer or late fall, and they're already supposed to be making winter bees, and those winter bees now have holes in their abdomen, and they are not going to survive winter. So this is a discussion where I have to talk to people about what are you doing with this hive, because this hive's likely not going to survive, aka this colony's not going to survive. So we could take the honeybees or the components of this colony, make them a little healthier by getting rid of the mites, and then we could boost up one of our other colonies to help them get through the winter. That's usually going to be the lesser of 2 evils, because this hive is going to likely die anyway. I've been doing it long enough. I used to just let them be like, okay, well, we can try, but in all honesty, you're going to be farther ahead if you treat them for varroa mites, treat the rest of the hives depending on what's going on, and then do some combinations so that they have bigger hives going into the winter. I put this in here. This is what we would do when we did our Sentinel Be Informed programs. This was the Michigan State one. So you've got codes for each of the hives. You would do 4 or 8. So Michigan State for the vet students, we would do 8 of them. But it really just highlights like you can, if you only did 1 mite count, I mean, depending on which hive you were, what time of year, you might be like, man, I am a really good beekeeper. Like everything's great. And then these are Michigan State run hives, Michigan State, Megan Milbrath, Anna, everybody that knows what they're doing. So this is not a, like same thing with parasites, sometimes, or diseases. Sometimes we can be really good farmers or really good beekeepers, but we're still gonna get disease in our hive because guess what? The farmer down the road is probably not a good beekeeper, and the one a mile away, maybe not a good beekeeper. And honeybees can go 2.5 miles. So you can get these, what we call mite bombs, when that hive died, and all of those honeybees that now have mites on their backs flew over to your hives and joined your hive because it looked really happy, healthy, and had lots of food. And so they decided to move in. And what do? They brought the varroa with them. And I wish I had the other data here. I do have it. I need to put it into the slide. But what ended up happening is we treated these hives. Some of them actually had European, not European, all those photos that you see of the parasitic mite syndrome, they're all from these hives when we were doing the research. So you can see these hives, you're going to need to treat them. And then we did some combinations. And obviously, it's really nice to have data in front of you, right? Because what hives were the healthy hives? Well, on paper, they were these 3 hives. Visually, if they were these 3 hives, then we're just going to combine, and the one at the bottom, which I'm forgetting, interestingly, 4 and 4. So we just did some combinations and boosted these hives up going into the winter. Okay, I know I don't have a lot of time. I'm going to give you guys a couple more slides of just some really cool things. I'm going to try to do this and be really nifty and fancy. Let's see if I can do that. Do you think I can play it from there? I'm going to have to probably minimize it. Let's try it. I got it. This is just gross, and I like gross things as a veterinarian. This is, does anybody know what this is? Very good guess, but it's small hive beetle. So these are, you can't see the beetles, but these are the larvae of the small hive beetle. And so you're going to see that if you have a hive that is struggling. All right, now how do I get back to this though? That's gonna be the question. Kyle, help. I don't know, is it up? No. There was a discussion because I am a MacBook person that I wouldn't be able to handle this, so clearly I wasn't able to handle it. But the point there is that's usually not the disease. It's usually the hive gets so weak. Strong hives can handle small hive beetle, no problem. They'll just take care of them and they kill them. Disease hives will not be able to, and you'll go in and they'll be like disgusting, and the larva will be taking over and the bees will be taking over. And so this is what the hives will look like. So most of the time there was something else going on with that hive. There was parasitic mite syndrome or European foul brood or something else, and the hive just got really sick, and the small hive beetles, which look like these, decided to move in because it was a nice place to live, which is why mice move into your hive sometimes. It's a beautiful place to live. So you don't need to treat this with antibiotics. You can talk to them about having healthy bees so they can take care of them, traps, making sure the hive was clean right, are there food sources, is it disease-free? And a lot of times you have to put them into a new hive, and these are usually struggling hives, so you usually can't. I have 2 more cases. I'll just go through and kind of show you guys pictures. Staph brood virus is a big one. This is all over the MSU website. But one of the things for pictures to look at is they have these weird little like heads that are coming out, and you can see like, here's actually a better picture. You're gonna see this as one of the like pathognomonic signs. And when you pull these larvae out, they're in a sac, hence the name staph brood. And so that's a pretty like pathognomonic sign. And one of the things to know about that is it's a virus, so we're not throwing antibiotics at it usually because it's a viral disease. And most of the time, if we can support them through it with nutrition, making sure they're clean right, do they have enough worker bees, do they have enough food stores? If not, we probably need to feed them. We're basically supporting them through this viral disease. So it's like you were having a viral GI bug. So self-limiting. Sometimes you may need to requeen, but again, that's really, requeening is just to give them a break, because what are the bees doing in the hive? They're like all the time taking care of the larva. And if you give them a queen break, then they don't have a job anymore. And this is what it looks like in the, this is actually, I'm sorry, this is another case. So, sac brood, if it's sac brood looking for the queens and it turns black, where the queens are like in this little sac. So these are queen cells. These are where the queens are developed. And so big breeders will do, big time beekeepers will do queen rearing as well. And then they were getting this problem where all their queens, like 90% of them were dying, and they would break open these queen cups and they would find these queens that were kind of in a varying stage of dead. And most of the time it was really just nothing was left and they had these black sacs. That is black cell queen virus, which is really cool because I had pictures, but not really cool if you are the beekeeper because you have to do a lot of disease. So again, this is where biosecurity comes in. They basically have to take everything apart and completely start over. And most of the time when you're doing queen rearing, you have to not only sanitize the equipment, you have to replace a lot of the equipment because it stays in the brood comb. If you remember anything, the brood comb loves to just harbor all the diseases. And you have to start with a healthy colony again. And that takes a lot for people that are queen breeding because it takes a lot to get a colony big enough, robust enough, healthy enough to start pulling to make queens from. That's a whole another hour talk, but there are a lot of beekeepers that do that. And this was pretty cool because I had never seen it before. And this was a big time beekeeper that I work very closely with. And he's involved with a lot of our teaching hives and was really bummed because he was like, hey, I think I have this. Will you come out and confirm it? And then sent a bunch of pictures off to Megan. And this was absolutely one of the times where we said, you know, what do we do with the hive? You know, do we try to save it? Instead, we just took all the components of the hive, AKA the queen, the bees, that stuff, and then trash the rest of the hive. And there are ways you can sanitize it, but like wood equipment and wooden frames are like 50 cents to $1 maybe. And so oftentimes if you're putting enough money into making queens, you're gonna want a fail-proof clean hive to start over from. You're not gonna wanna be like, well, I kind of sanitized it and maybe I won't have black cell queen virus. You don't want 90% of your queens dying. So you wanna sanitize that. And this is just a repeat slide to just remind you guys to look at everything as a herd health or hive health approach rather than an individual animal. And that's it.